Welcome to the Alliance Lift, the podcast that brings you closer to the people driving change in health policy and systems research around the globe. I'm your host, Sheikh Mohammed. Each episode dives into the work of Alliance alumni's experiences, with the Alliance Lift podcast making 3 stops along the way, learning from the past, living in the present, and leveling up for the future. Whether they're embedded in ministries, rooted in communities, or as in today's case, leading in academic spaces, our alumni are continuously raising new questions, inspiring action, and expanding the horizons of HPSR. And that brings us to today's guest, Dr. Eric Ssegujja. Eric is an experienced health policy and systems researcher with a strong record of impactful research. He describes himself as a passionate public health trainer and thought leader in the field of health policy, particularly in the domains of adolescent, maternal, newborn and child health, health taxes, urban health, and knowledge systems. Eric is currently a postdoctoral research scientist at the Makerere University School of Public Health in Uganda, where he focuses on health systems management and policy. He holds a PhD in public health, along with degrees in sociology and global health. Eric's experience also includes collaboration with a variety of organizations like the WHO, USAID, the World Bank, and UNICEF, among others. He's a member of several international health membership organizations, such as Health Systems Global, and has mentored over 50 master students in public health. It's a true pleasure to have him with us today, reflecting on his journey and the critical role health policy and systems research plays in shaping the future of global health. Eric, thank you so much for joining us today. After hearing that introduction, and when you think back on your journey in this field, what comes to mind?
What comes to mind is that it's important to do something that you're passionate about and do it diligently. Within the field of health policy and systems research, methods are really very important. Having a good framework is very important. Having a good theory is very important. That's what I can summarize as what comes to my mind when we talk about health policy and systems research.
So let's rewind a little. This is learning from the past. Eric, you've had such a rich and varied career in health systems research, as listeners heard in the introduction. If you had to sum up your early career in just 3 words, briefly, what would they be and why?
Hands-on beginning. Those are the 3 words that I would sum up my early beginning. Why I would say that is that I did not start out as a health policy and systems researcher, but rather it's through the works that I was doing, the networks that I was embedded in, that I've eventually evolved to become a health policy and systems researcher. First, I worked on a project that was looking at strengthening district health managers' capacity for evidence-based planning. And that was headed by Professor Peter Waiswa. I really learned a lot from that. It was purely health system strengthening that had both the supply side, looking at the service delivery, but also the demand side, looking at the communities, how to make them active participants in improving service delivery. We did a lot of work which informed national level guidelines that are now nationally part of the routine management practices. We specifically developed the bottleneck analysis that helps district service managers to look at the underlying bottlenecks that are impeding their service delivery. Before we moved in, the kind of planning that was characteristic of the district service managers was that they would have a work plan for this year. They would implement whatever they would implement, and some activities would end up not being implemented. So for the subsequent work plans, the practice was that they would get these activities that are not being implemented, they carry them over to inform the next work plan. So that contextually is problematic, because the factors that may have impeded implementation of the previous year may still be persistent, or things may have changed that is not contextually relevant in the following year. So we came up with a bottleneck analysis. Basically, it's a diagnostic tool to diagnose and see what are those factors. And once that is used, then we are on the path to getting evidence-based work plans. That really informed me a lot, and it really contributed a lot. And once I settled in, had to embark on my PhD journey, which was purely health policy and systems research. And along the way, I did many short courses exposure at the Institute of Tropical Medicine, at the University of Western Cape, and other institutions that really supported me along the way.
Thank you, Eric, and congratulations on that work. And I understand why you use the words hands-on to describe your journey. It sounds like you had a very good support system behind you in those early days of your career. Before we dive into the various projects and what you're working on today, I wanted to talk a little bit about your connection and collaboration with the Alliance. So, of course, you and I are working together currently on the Partnerships for Stronger Knowledge Systems in Africa, NOSA for short, where the Alliance is supporting partnerships between policy and research institutions in East African countries, including Uganda. And it was during the first inception meeting for this work in Addis Ababa where you and I first met. So do you have any reflections from that meeting? How has that sort of shaped your approach to tackling complex health challenges in health systems?
It was a methodology harmonization meeting where different teams meet and harmonize the methodologies that will enable them to accomplish the task beforehand. Alliance is very strong in this because as people from diverse backgrounds, clinical, biomedical, public health, sociologists, journalists, and all engineers and everyone that is involved in health policy and systems. So it's highly likely that you will have different approaches to confronting complex public health challenges. So I was open to learning and learning from interacting with the different teams. And with the health policy and systems, it's very important to have a grip on the methods and the theories. Actually, mentors that have been there before us say that once you don't get the methods right, you are likely to miss out on many things. Once you don't get the theories right, you are likely to miss out on many things. Once you don't get the frameworks right, you're likely to land into challenges which would have been easy to address. It's a two-way. You can either get lost in your own methods or the methods can lose you along the way. So it's very important. So when I see opportunities like the Ethiopian experience, I see an opportunity to learn, to add on to the skills that I have.
Oh, it's wonderful to hear such great reviews, to hear that these workshops are actually achieving their intended objectives, creating these platforms, having these meetings where partners can collaborate and push each other to think differently and have different perspective methodologies, as you said, especially when we're dealing with complex subjects such as strengthening knowledge ecosystems. It's about also building those relationships and learning from each other. So from our side, it's fantastic to hear that, and thank you for that reflection. But Eric, I also understand that you've been involved in several other projects with the Alliance. So I was wondering if you could share a bit more of those experiences and how they've influenced your perspective of health policy and systems research. For example, I know you received a grant to work on sustaining effective coverage in the context of transitioning from external assistance, a topic that feels very timely today, especially in how global health landscape is shifting.
Thanks so much. And I would like to appreciate the team at the Alliance for being farsighted. By the time they put out that call, things had not happened the way they have happened this year. So they put out that call seeking to know the experiences from different countries, case studies, how things are shaping up following cessation of funding from the donors. Our team presented two case studies. One was looking at maternal and child health. The other one was looking at HIV/TB intervention in Uganda. And the key lesson that we learned from that was that whereas government was able to take on where the donors had previously funded in maternal and child health, the same government with the same commitment was struggling, the health systems were struggling to absorb all the aspects that were previously supported by the donor funding in HIV. That was the key lesson that we learned from that project that we shared out, and we hope others can learn a lesson also and see how to tailor their intervention based on the learning that we were able to do here.
Thank you, Eric, and I'm sure there is much to learn from that work that you conducted. I think there's so much to gain when countries start to rely more on domestic systems and resources, especially for things like HIV and maternal and child health. And it touches upon really important questions such as sustainability, ownership, equity. all at the core of the work that we do in health system strengthening. So let's fast forward to today. This is living in the present. Eric, your work today is on health systems management and policy, focusing on areas such as reproductive health and health taxes. How would you say your previous journey has influenced the way you approach your role today as a research scientist at Makerere?
So my past journey and how it has shaped that is that my engagement has mainly been in teaching, research, and community services. In teaching, the research that I conduct very much informs the kind of teaching that I do, and oftentimes I use the examples, the learnings from the research that I conduct to inform the teaching. But also whenever the opportunity presents themselves, I make sure that I also offer an opportunity, because someone had to take a chance on me to say, you come and we venture into this. So I extend the same. Usually when I see students that are really passionate in pursuing career in health systems, whenever there are research opportunities, research tasks, they are the first one I'll pick on to try to introduce them into the field, even before they complete their studying. But also in the area of health policy and systems research, the aspect of community service. It's not that you're going to go deep into the communities, work with them, but we deal mainly with the health policymakers, legislators, health systems managers, and that kind of thing. So the kind of community service that is predominantly into this is sharing the evidence with health systems managers and the policymakers to see how they inform their policymaking, also to see how they inform their programming and intervention implementation. That's the community service that we do here. So briefly, I would say that's how it has shaped where I am now.
Thank you, Eric. And you were mentioning your students, and we heard earlier that you've mentored over 50 students so far. What would you say has been the most rewarding part of mentoring and teaching the next generation of health systems research leaders? And does this mentoring influence your own work? Does it feed back into the way that you do your research and training?
My most rewarding experience has been that usually I teach both undergraduate and master's students, but it's not a requirement for an academic award that they must publish in a peer-reviewed journal the work they do for their academic award. But it has surprised me quite often that these students, after submitting their dissertations for an academic award, they go ahead and express interest to publish in peer-reviewed journals. So that kind of motivation and the inner drive that is in those students has really been surprising to me. And whenever I spot such a character, I make sure that I do all it takes to support them to accomplish what they want to achieve in life.
They sound like very lucky students. And what would you say for someone like you who works at the intersection of research, teaching, and policy? What is the key to ensuring that academic and research insights are translated into real-world policies and impacts, particularly in shaping health systems and policies?
That speaks exactly to the work that we are doing in the NOSA project. That is one aspect to generate knowledge, but it's also another aspect to generate interest in the knowledge that you've generated, to make sure that the utility of that knowledge is really addressing real-world challenges. I've always tried to make sure that the evidence that we generate gets to the people that need it most. If there are recommendations to improving health services management, if there are policy recommendations, my drive has been to make sure that I move up to that level, to make sure that they receive this evidence and they use it responsibly to inform the kind of work that they do. It may be for health systems managers, it may be improving practice, but also for policymakers, it may be that critical evidence that they need to inform their legislation and policy making.
Wonderful. Thank you so much, Eric. So now let's shift gears to the future. This is leveling up. We just talked about your mentorship and how you supervise and teach students. So say I was a student in your class and I came up to you. What advice would you give to a young professional just starting out in the field of health policy and systems research?
So the first thing, first and foremost, is to identify a mentor that is willing to support you, but also you share some common interests. Yours have to be aligned to the mentors, and if they don't align, look out for the next mentor that will align with your interests.
Wonderful advice, Eric. And looking ahead, what sort of emerging trends or ideas in health policy and systems research are you particularly excited about?
One aspect that is before us is the use of artificial intelligence. Before, individuals used to use their brains, and if you fell short of addressing the issue, you would go to the next human to support you. But right now, everything is in our palms, use of artificial intelligence. And what I would emphasize is the responsible use of artificial intelligence in health systems and policy research. That's the next hot topic. How to navigate the two and not lose out to the human face amidst this is very important, but also leveraging on these tools, because society is evolving. Now technology is here. We are not going back, but how do you ensure that you match those two to make sure that you advance the field of health systems research and policy?
Wonderful. Yeah, I think that's a good reminder for all of us at this stage, not just navigating how to use AI and taking on this new technology, but also how to use it responsibly. And it's interesting to hear that there's still a lot of new topics and emerging trends that are coming up, even for someone with such a deep and established career, that there are still topics and things that are exciting you. And with that, we're approaching the closing, Eric. So I just want to say thank you. I think your story is a wonderful reminder of the impact that both research and teaching can have on shaping the future of health systems. So before we close, I just wanted to ask, do you have any final thoughts, comments, words of wisdom you would like to share with our listeners?
I'll have two things. For anyone out there that is willing and interested to engage in health systems and policy, methodology is very important. Having the good theory, having the good framework, matching it with the methods and the topic that you want to study is very important. The last one is responsible use of artificial intelligence in health policy and systems research. I know it will take us far if we start on a good note. Thank you.
Fantastic. Thank you once again. And I look forward to seeing you in Kampala for the next NOSA workshop. And to our listeners, you've been listening to the Alliance Lift. My name is Edo Sheikh Mohammed. Thank you for taking the ride with us. If you've enjoyed this episode, please consider sharing it with others in your network, especially those in the health policy and systems research community. You can also sign up to the Alliance Alumni Network on LinkedIn to stay connected to all the latest happenings in HPSR and to hear more stories like this one. Until next time, take care and keep doing the work that lifts others too.